Here we present a case of severe internal carotid artery stenosis that was treated with carotid stenting and angioplasty and the use of intravascular ultrasound. This is a 71-year-old male who had a left carotid artery stenosis treated with stenting and angioplasty a few years ago. Now he presents with TIA symptoms of the left upper and lower extremity. On exam, he was neurologically intact. CTA and carotid Dopplers demonstrate moderate to severe right internal carotid artery stenosis, as you can see here in this angiographic picture. The patient was already on dual antiplatelet therapy. After obtaining access through the right femoral artery, access into the right common carotid artery is now established, as you can see here. Using an intermediate catheter, in this case a PTEC catheter, the guide catheter is sliding through the intermediate and glide wire until the distal portion of the right common carotid artery is obtained, as you can see here. First, we obtain baseline images to measure the degree of the stenosis and the length of the carotid artery that we are going to cover with the stent. On the roadmap, we cross the lesion with the microwire carefully until we reach the vitreous portion of the internal carotid artery, followed by the distal filter that we just deploy in front of C1. The first step is to do a balloon angioplasty, as demonstrated here. We inflate the balloon for at least 30 seconds. Then we exchange the balloon for the stent. The stent is then slowly deployed, making sure that we cover the entire length of the stenosis and there is good wall opposition of the stent. Once it's fully deployed, we exchange the stent for the intravascular ultrasound, also known as IVUS. This device will allow us to see the inside of the carotid artery and inside of the stent, looking for debris or the possible need of a secondary angioplasty. Here you can see how the stent is well opposed to the artery. The intravascular ultrasound is removed and the distal filter retriever is now capturing the distal device. Final run demonstrates excellent angioplasty and stenting of the right internal carotid artery.